Let's discuss amyotrophic lateral sclerosis, that is ALS. It is the most common form of progressive motor neuron disease. It involves the both lower motor neurons that consists of anterior horn cells in the spinal cord and brainstem neurons innervating the bulbar muscle, and the upper motor neurons, which are the corticospinal neurons. At its onset, ALS may involve selective loss of function of only either upper or lower motor neurons, but it ultimately causes progressive loss of both upper and lower motor neurons. The initial sign of the disease with lower motor neuron involvement is an insidiously developing asymmetric weakness, usually first evident distally in one of the limbs. Patient may disclose a history of recent development of cramping with volitional movements that typically occur in the early morning hours, that is, while stretching in the bed. Weakness is associated with progressive wasting, atrophy of muscles, and spontaneous twitching or fasciculations of the motor units. Involvement of the bulbar muscles leads to difficulty with chewing and swallowing, as well as fasciculations of the face and tongue. ALS with prominent corticospinal involvement is characterized by hyperactivity of muscle stretch reflexes such as tendon jerks and frequent spastic resistance to passive movements of the affected limb. Ocular motility, sensory, bowel, bladder, and cognitive functions are preserved even with the advanced disease. If we talk about the treatment part, the drug called riluzole, which is the glutamate inhibitor that is currently approved for the management of ALS. Although it cannot arrest the underlying pathological process, it may prolong survival and delay the need for tracheostomy. The life-threatening complication at the last, that is the diaphragmatic paralysis, could be caused by ALS, and that requires tracheostomy and artificial ventilation to be done. Thank you.